Hi, welcome to another edition of Strive Sessions. My name is Valerie, and I'm a pharmacist for Strive. Today, we're going to be talking about NAD+. I do want to go over a quick disclaimer on NAD+. The information in these slides is for educational purposes only and is not intended to be a substitute for professional medical judgment, diagnosis, or treatment. Compounded medications are specifically prepared for individual patients and as such have not been reviewed or approved by the U.S. Food and Drug Administration. These statements have not been evaluated by the FDA. Today's agenda, we're going to talk about NAD+, the mechanism of action, some potential benefits, dosage forms, precursors and pathways, and then we'll get into some questions. I want to start by addressing that NAD+ has been very popular on social media, including celebrities such as Hailey Bieber publicly expressing excitement about its potential role with wellness. You've probably heard your patients ask about it or talk about how they saw NAD+ on social media. So first we're going to talk about how NAD+ works. The full name is nicotinamide adenine dinucleotide. It's a coenzyme that plays a crucial role in various cellular processes. Here are some of the key functions of NAD+ in the body: energy production, DNA repair, cellular metabolism, antioxidant activity, neurological function, immune function, and anti-aging effects. The role of NAD+ in cellular respiration. So we did say it's a coenzyme present in all cells. It does not provide energy directly, but accepts and carries electrons, making it essential for extracting energy from food molecules during cellular respiration. Some key points: NAD+ is that coenzyme, which is essential for energy production. It acts as an electron carrier and not a direct energy source during metabolic reactions. We're going to go back to science class here and talk about the Krebs cycle, the electron acceptance and reduction. So NAD+ accepts electrons, becoming reduced to NADH. This process primarily occurs in glycolysis, the Krebs cycle, and beta oxidation. This temporarily stores energy for later steps. NADH and ATP formation. The NADH delivers high-energy electrons to the electron transport chain in the mitochondria. We all know that's the powerhouse of the cell, where those electrons are used to establish a proton gradient powering ATP synthesis, the main energy currency of the cell. NAD enables but does not supply the cell energy. As we talked about, it's indispensable for ATP production and healthy metabolism, but it is not itself a source of energy. Instead, it facilitates the transfer of energy within the cell and also supports DNA repair and cell health. I now want to talk about the natural NAD+ decline. So NAD+ levels naturally decline with age, and it's associated with various age-related conditions. NAD+ levels can begin to decline in most adults during their 30s. And as you can see from this chart, it declines quite a bit over the next couple decades. That's why supplementation is so important. Why does NAD+ decline? NAD+ declines with age due to an imbalance between its creation and consumption. As we age, more things need to be repaired, and our NAD+ cannot be made fast enough. So increased NAD+ consumption, reduced NAD+ synthesis, which also can lead to inflammation. So if we have inflammation in our body, NAD+ needs to be present so that we can fix those things. Overactivated NAD+ consuming enzymes as well. There are some things we can do in our own lifestyle to help decrease the decline of NAD+. So some factors that cause NAD+ to deplete faster are smoking, including e-cigarettes, drinking alcohol, and just leading an unhealthy lifestyle and becoming obese or having a metabolic syndrome. This can lead to inflammatory disease states and even neurodegeneration. We'll talk about some NAD+ supplementation and the products that we have here at Strive. First, I want to remind you about the NAD+ potential benefits. One being energy that comes along with NAD+ supplementation. We also can repair DNA. We can lower blood pressure. It can help digestion, can help mental clarity, can also help with addiction recovery, which we'll cover in these slides. Strive has a couple different dosage forms. This includes injectable, nasal spray, cream, and now we have a convenient FlexDose tablet. Here we have some illustrations of our products: the injectable vials, our FlexDose tablets, the nasal spray, and our restorative cream. You may remember that we used to have NAD Plus in a troche form. The FlexDose tablets replace that form. The FlexDose tablets are sublingual and dissolve very quickly under the tongue, faster than the troches did. Our injectable formulation, NAD Plus 200 milligrams per ml, comes in a vial. We have either a 6 ml or a 10 ml vial. It is important to note that all NAD Plus forms need to be refrigerated. The BUD, or the beyond use date, on our injectable formula is 45 days. We do have a suggested titration dosing schedule. It can be injected either sub-Q or IM. We're very conservative. We like to start low and go slow. We start with 10 units weekly, 3 times a week for 1 week, and then you can move up slowly from there. Keep in mind that there are some side effects to look for. Injection site reactions can happen. One of the other main side effects that people see is a flushing feeling. We do recommend that you advise your patients to inject while sitting down or near a chair in case they get this feeling. It typically goes away pretty quick. We also have an IV infusion protocol. The IV infusion, we do not provide IV bags, but we do have a protocol for those of you who want to use IV NAD+. This is a very popular route. It should be noted that it is more expensive and it takes a lot longer time. It involves a couple hours in an IV chair, and the side effects of the flushing can be more extreme, more severe. There are some monitoring parameters listed here. Also, if you're doing NAD plus IV, you can use this therapy for addiction. This is a relatively new therapy. There are some websites you can visit to look at NAD plus for addiction. There are potential benefits of reducing withdrawal symptoms that make recovery difficult. It can restore the natural energy production. It can also help curb cravings of alcohol and opioids. There is an approach for the IV for addiction, and it's usually a couple times a week in the IV chair, and then you can assess and follow up in 1 to 2 months with the patient. We also have NAD plus FlexDose tablets, like we had mentioned at the beginning. These are sublingual tablets. They do dissolve under the tongue very quickly. I do believe they are a marshmallow raspberry flavor. And once again, even though these are tablets, they still need to be refrigerated. Our suggested directions are to dissolve a quarter tablet, and I should mention that the FlexDose tablets break very easily when pressed on with the thumb. It'll break evenly into 4 pieces, and you'll take a quarter of a tablet under the tongue in the morning on an empty stomach, and you can increase that every week. If the patient is not having any side effects and they're tolerating them well, you can certainly make the decision to move up faster, up to 1 tablet daily. We also have our nasal spray. So NAD plus nasal spray comes in many different concentrations. We have the 50, the 100, 200, and 300 milligram per ml. Also needs to be stored in the refrigerator, and we recommend 1 to 2 sprays in each nostril 1 to 2 times daily. The beyond use date on this product is only 35 days. So that's something to keep in mind. The next product we have is the Restorative Cellular Cream. This is one of my favorite products. It is an NAD plus 10% cream. It is applied topically. It can help promote cellular repair and regeneration on the skin. It also helps improve skin elasticity and firmness. It may also help UV damage, and there is some research out there that indicates it may help with precancerous skin cells. So if you're like me and you grew up in Arizona and your nose was burned all the time, it might be beneficial to start utilizing this product in your skincare routine. As a reminder, it is stored in the refrigerator. We do recommend applying a small amount to a clean and dry area morning and night. Before I get into precursors, I just want to talk about some contraindications really quick. All of the NAD plus products do have the warning of not using in patients with a history of cancer. So this is a shared decision-making situation with the provider and the patient, but there is evidence out there that NAD plus can help cancer patients, but there's also evidence out there that it can proliferate cancer cells. So we don't want to take that chance, but that is information for you and your patient. There are some precursors when it comes to NAD+. So if we want NAD+ to naturally produce in the cell, it's sometimes easier to add on a precursor. So that means that it's a little bit back on the pathway to help increase the intracellular NAD+. We have a couple different precursors. One of them is diet, and we'll go over that on the pathways on the next slide. We also have niacin, which is a very popular supplement. We have nicotinamide mononucleotide, which is NMN. We have nicotinamide riboside, which is NR. These come from two different pathways, which we'll talk about here. We have the de novo synthesis, that's the diet. We have the Priest-Handler pathway, which is the nicotinic acid. And we have the salvage pathway, which is NR. Also can be NMN on that pathway. With nicotinic acid, it is known to be a less efficient pathway and has to go through a lot more process. So it is not the preferred precursor for NAD+. The salvage pathway is much shorter. And when you see in this slide that the NR is pretty direct, NR has the most research of benefit for producing NAD+. You can do NMN, but as you can see, it's further down the pathway on the salvage pathway. So the number one recommended precursor is NR. We do carry an NMN supplement. It is through our Strive shop. It has those potential benefits of anti-aging, improved cognitive function, cellular health. It is manufactured, so the BUD is longer. You can take 1 to 2 capsules by mouth 1 time daily, and it's stored at room temperature. We also have on our Strive supplements Regen Plus, which now has NR in it, so that nicotinamide riboside. Regen Plus is a Pharmacist formulated supplement. It's designed to help support cellular vitality, potentially slow the aging process, and can help promote overall longevity. Also manufactured specifically for Strive, and it's room temperature, so the BUD is longer, and it's 2 capsules by mouth daily with or without food. Also available on Strive Shop. These are some references, and then happy to take some questions from the team.
Hello, thank you so much for joining us for our Strive sessions on NAD+. Thank you so much, Valerie, for taking the time to explain to all of our providers, some of our patients, what NAD+ is, what we offer as far as NAD+ goes. So we did have some questions in the chat. I will first start by stating that I use NAD+. I think it's fantastic. It's one of my favorite Strive products. I've been using it as the injectable form for quite some time now. I was just talking about how much caffeine I consumed this morning. And what I should have done is just used my NAD. So anyway, we thank you for taking the time to listen today, and we'll answer some of the questions. Now, some of these questions may have been answered within the webinar, but I will ask Valerie some of them. That way we can just reiterate some of this information. I'm going to start with dosing recommendations. So what is the most common starting dose, and how often is it used? How high do we recommend going as well?
Yeah, that's a great question. We offer a couple different dose forms that we went over in the webinar, but a lot of patients use our injectable. So the injectable, we typically ask to start at a 10-unit dose 3 times a week. And then you see how your patients are feeling. If that is an effective dose, then you can move up. You could stay at that dose. If they aren't feeling the effects, we can move up to a 20-unit. Think we go all the way up to 50 units 3 times a week. We have our FlexDose tablets, which we can obviously, if you have seen them, if you haven't, reach out to a sales rep. But we have great FlexDose tablets that separate easily into 4 equal pieces. So you can take a quarter of a tablet daily, and you can move up to a full tablet daily. So those are some of the recommended uses there. We also have our cream that we talked about, and the cream is used daily. I know you talked about the products that you like to use, and I actually use the Restorative cream or NAD Plus cream, and I just started taking the Regen Plus like yesterday. So I'm excited to see how that goes.
Yeah, that's awesome. Thank you so much. Thanks for that information. Now, we have had questions about the bioavailability of the difference between, the injectable product and the oral product. Can you kind of explain that and why, while we say it's oral, maybe it's not, maybe that's a little bit misunderstood?
Yeah, absolutely. So obviously injectable is going to have some great bioavailability, but our FlexDose tablets are actually sublingual, as we discussed in the webinar. It dissolves under your tongue. So you're not actually going through that first pass metabolism. You're getting absorbed through the mucosal membrane. So, and that one we do take daily because there is a decreased bioavailability, but taking it daily and then also absorbing through the mucosal membrane is a benefit there.
Awesome. Fantastic. That's a great answer. How long can you utilize NAD? Should we cycle it? Can it be used indefinitely? What are your thoughts on that?
As far as I know, I think it can be utilized for quite some time. There's not all the studies I read didn't have cutoff points, but make sure that you're monitoring your patient as one would. Make sure you're checking their labs and that you are checking their side effects, all of that. If you need to stop the medication, we can absolutely do that. But there's no cycling parameters that I'm aware of.
Okay, fantastic. Thank you. Now, we talked about contraindications. We spoke about contraindications as far as with the cancer risk and whatnot. What other patients should maybe not utilize NAD+?
Yeah, so definitely the cancer patients are a contraindication. So if you have a current cancer patient, we don't want to do that. If they have a history of cancer, that we talked about was a shared decision-making situation. Also, we want to make sure that pregnancy, breastfeeding, there's not enough evidence out there. So what we always say when there's not enough evidence out there, it's a no. We usually want to wait till that breastfeeding's done, or maybe about 6 months to a year postpartum. I always like to be conservative on that because your body's still changing after you have a child for quite some time.
Yeah, absolutely. You're absolutely right on that. So thank you so much. There have been questions regarding, can you utilize the oral with the IM, with the topical? What are your thoughts as far as utilizing more than one type of product at the same time that contains the same active ingredient?
That's a great question. I would say you could utilize the injectable or the FlexDose tablet, but you can utilize the cream in addition to either of those two, because you're not going to get a lot of systemic absorption through the cream. That being said, I also think it's beneficial to add on a precursor. If you're taking the NAD plus, you can add on the NMN or the NR that we talked about.
Awesome. Fantastic. So this is a good one. We have a question/statement that says, what's the most significant feeling one should experience if using it for longevity? They may not know what to expect. So this individual said, I typically don't feel anything, but know it's working because of better focusing on my work and schedule. And I've noticed clearer skin as well.
I think that's exactly there's not necessarily going to be a feeling. I think when you have the IV or the injectable, like we talked about, there's sometimes a flushing feeling pretty early on. And then after that, you may not notice anything. And I've actually had people I've talked to say, I stopped taking it because I didn't think it was doing anything. And then when I stopped it, I absolutely noticed a difference. So there's almost that small incremental, your better focus, you're not necessarily going to feel longevity. So just knowing that it's working in the background, having some trust there, you can always stop it and see what you feel like the week after, and then you'll kind of know that it was doing something.
Yeah, absolutely. I know one of my focuses right now is my mitochondrial health. And I know that this product is really working behind the scenes to maintain mitochondrial health. Now, I will tell you, one of the side effects I know I've experienced is kind of a tightness of a muscle group, let's say. So sometimes that can present as a tightness in the chest, which can cause some anxiety to a patient. So just let them know, especially when they're starting it, they may notice that it's something that is very short-lived. But in patients who maybe have, history of cardiac disease or whatnot, it would probably be beneficial to definitely warn them of it and maybe not utilize the product in them, especially with those feelings and whatnot. So
yeah, that's a great point to make, for sure.
Yeah. Oh, I love this one. Okay, Valerie, does NAD Plus have benefits on patients that are on GLP-1s?
So one of the big side effects of GLP-1s, especially when you're starting out, is fatigue, right? If anyone started one, they know that there is quite the side effect of the fatigue, and then you don't necessarily want to eat everything. So now you're not getting those nutrients, and your body's not working as well as it could. Obviously, promote protein and a well-balanced diet on GLP-1s, but the NAD Plus can increase that acute energy. So we can get that side effect or that benefit from taking NAD Plus with GLP-1s.
Yeah.
And there's no contraindication there. So that's fairly easy add-on.
Yeah, there's not a contraindication when they're combined. So and like Valerie said, one of our goals, with GLP-1s is actually longevity as well. So this just goes hand in hand, which is just so great. So
yeah.
A lot of questions about labs. So lab monitoring with NAD, what's required prior to. So if you could give us any insight into that, that'd be fantastic.
So nothing's required, but for general patient outcome, you're going to want to look maybe at liver function, kidney function. Obviously, if there's some kidney function disorder, there might be some dose adjustment or maybe some shared decision making on deciding whether we're going to put them on NAD plus. We also, just the regular vital signs. Let's check blood pressure. Let's check how they're doing in general, and then continue to monitor those at your appointment. So whether you're doing 3 months, 6 months, or annual appointments, like let's make sure we're checking on those. There are also, as far as I know, there's NAD plus testing, but I've heard it's expensive. And then there's also it's hard to judge the intracellular NAD plus from those tests. So I think there is a test available, but also more expensive on that. But in intracellular NAD plus is where you're going to want to see the longevity or the mitochondrial health. And that's just a harder test to have.
Yeah, absolutely. And I love this question. We kind of covered it, but we're going to go back to those FlexDose tablets that we have. So there are a lot of patients that don't enjoy utilizing injectable medications. And that is why we have created the FlexDose tablet that is utilized sublingually. How would you dose a patient with those, similarly to how we would have utilized the injectable?
Yeah, I guess it depends on what the patient was on, but some people state that they'll start on the quarter tablet, and you do that for a week or so, see how they're feeling, and then they can move up to a half a tablet if they're starting from scratch. If they went from the injectable to the tablet, you could almost start at a half a tablet and see how they're feeling and go from there, because it is a daily dose at that point. But the full tablet, you can titrate up to that, and I would say once a week, change the dose if the patient's doing okay with side effects.
Yeah, absolutely. Thank you. Well, I think we honestly covered most of the questions. If there's any other questions that want to drop in here in the next minute, you're welcome to drop them in. There was one that was just stated that's asking if our NAD is patient specific or for office use. Now I will answer this one because at this time, Strive Pharmacy is a 503A pharmacy. That means every prescription is patient specific. So, hopefully that'll change soon. But in the meantime, it is going to be a patient-specific prescription. You are able to order the supplements that Valerie spoke about. So the supplements can be ordered, and that can be ordered kind of at a wholesale through a wholesale program.
Yeah,
So
you can absolutely set up a wholesale program through our website. That Regen Plus is on there. We have a slew of other supplements that are on there as well. So feel free to go on there and look around and see what's beneficial. We have made the supplement line to match what we do here at Strive. So the medications that we have, this is not your normal supplement line. This is very much formulated for a pharmacy by a pharmacist. So
thank you so much for your time today.
yeah, thank you for taking the time to be here today.
Bye.
Bye.